I lead that if you're not on camera, you don't get to come. No, I'm just kidding. You're
Yeah,
here, Gary. We love it. Hey,
yeah, thank
everybody.
you.
Welcome. I love that everybody's here. We're here for Tuesday training. We were just backstage in our green room talking Q&A about muscles, which is what we're going to do today. For those of you who are here on YouTube, welcome. I can see that you're here. Yay. And just a heads up, we're going to talk, well, a couple things. I've got like some admin to talk about today. Hi, everybody, and welcome. And welcome to the new people who are joining us. I know there's many of
Woo.
you who just found us on the YouTuberverse, and we're delighted that you're here as well. I am your host for this training. I was going to say for the hour, but that's one of the admin things I get to cover. I'm your host for this training. I'm Gina Schatz, and we are going to talk muscles and movement and Q&A on anything for an abbreviated Tuesday training today because I have a doctor's appointment. So we're going to be here for until the half past the hour. So please do, if you are here live in the YouTube live, type your question in the chat because it's a little bit of a delay for me to get to it. I want to make sure I answer all questions for today. And we started doing that backstage in our club seats. So Lori was asking a question about muscles. We are on muscles for this entire month. For the month of September, we're doing that here for Tuesday training. We're also doing it in our club. Our muscles and movement course is
Mhm.
running all month in the club for all of the club members. And you can join us there as my guest for a 7-day pass. Please do join in if you want to. Muscles is a fun topic.
Mhm.
I love muscles. To me, they're like friends. They're like buddies. They all have a name. They all have a name, of course. I didn't name them. And they all have a personality. I kind of gave them their personality, but actually I didn't. They gave themselves a personality. And they also run with a posse, right? So the synergists are the helper bees of the main guy who does a joint action. And this is really important because, well, because A, it's most of our musculoskeletal work that we all work on as body workers, manual and movement practitioners alike. And it also came up this week while I was working with some practitioners one-on-one in the accelerator program about really getting to the source, the cause of a musculoskeletal issue. We like to point at muscles. Sometimes we still like to blame muscles. Don't do that. They're not at fault. They are just trying to communicate. But still, we get distracted a little bit by symptoms, and chief complaint doesn't always match like a pain pattern. And so, what do I do? What do I do? Is the question that I love to answer. And the answer largely lies in muscle knowledge. Largely
Mhm.
lies in muscle knowledge. So I'm going to walk you through today a formula that I gave a practitioner I worked with one-on-one so that you can also navigate that as well. And not too coincidentally, that was similar to the question that Lori had when we were backstage for the green room club seats. And the question, Lori, was about synergists
Mhm.
and was a two-part question. We got to the first part. This question was like, how many synergists do you assign to a prime mover? As many as there are, shorthand. However, you really want to prioritize them based on how much lifting they do. Because
Mhm.
the amount of lift that they are assigned to do, the closer to proximity to the agonist, the main mover that they live, the more role and responsibility they have,
Mhm.
so that if
Okay.
they drop the ball, it's kind of a noticeable thing.
Mhm.
Whereas, the seventh synergist down the line who can only sort of help in a specific
Mhm.
setup isn't always going to be called on to help. So you get to still know what that is,
Mhm.
but not in your first run of memorization of
Okay.
muscles. But once
Mhm.
you do know him, then of course, once you know something, everybody's on the chopping block as part
Mhm.
of the possible problem and also the
Mhm.
cause of it. But to answer the question that you gave me, Lori, and to share it with everybody, you do get to learn the synergist, but not first.
Mhm.
So let me roll back a little bit.
Mhm.
Lori's been training for a high level training for quite a while. And so we're at the place at that level of training where you do get to memorize 7 synergists for a prime mover. If some of you are listening right now and you're like, what the freak is a
Mhm.
synergist? And how do I know it different from a prime mover? And what are you all talking about? No problem. Take a deep breath. And here's what you do:
Mhm.
one muscle at a time. And the muscle that's doing the contraction is the one that you want to learn. Always one muscle that does contraction. That's how you want to roll it out. too quickly, we can pile drive ourselves with reciprocal inhibition, all the muscles that work in concert to make the
Mhm.
beautiful song. And as soon as you're pile drived, you're piled. And so then
Mhm.
you can't actually see the forest through the trees. So step by step, everybody, no matter where you are in your muscle knowledge journey, one muscle at a time. And I highly recommend that you pick the main muscle that does the contraction.
Mhm.
Okay. And then you can start adding on the synergists. So Lori's 7 layers down on a synergist of the specialty
Mhm.
actions of some muscles. And so that's what we were talking about backstage. And Lori, did you get full clarity on that question?
I did. I also love what you said, and it lands when it lands.
Mm.
Like look at what's closest to the
Mm.
main muscle.
The
Like, of
agonist.
course, when you said that, I'm like, oh, of course, of course. And I
Yeah.
also pulled up a photo of Pure Firmus and the Go-Go's, and I'm like, of course, the Go-Go's aren't the main. Like, I can sit right when you said that, and now
Yeah.
I'm looking at it. I'm like, ah, yeah, of course.
Okay, good. Well, I
So
like
that
that
was
that you
helpful.
added the visual. Yeah, beautiful. I'm glad that you added the visual end of it because we do talk about that in the course in
Mhm.
muscles and movement. There's a lot of information to glean about what a muscle does and how it can get in trouble and who it shows up for and how to know if it's not showing up. There's a lot of information to glean on just studying the muscle itself, which is not the same as memorizing them, which we all did in school, like especially
Mhm.
massage therapists, we all memorized the muscles and the origins and insertions. And that was helpful, absolutely. But then when I really just like sat with a book and saw the striations of a muscle and saw their location relative to the joint that they move and how much of the joint that they cross, it
Mhm.
really started to unfold a whole lot more information about what they actually do and when I need to call on them. And that's what I outlined for you in the muscles and movement course. I don't need you to just memorize a whole group of muscles. What I want you to have is how they apply to the work that you're doing and how
Mhm.
they show up to create the musculoskeletal problem that your clients present with.
Mhm.
So that's what we cover in the course. And I'm glad that you used that visual and that you reminded me so I could tell everybody else too, Lori. That's
Mhm.
beautiful. Amazing.
Mhm. Cool.
Okay, then you had a part two of your question. And again, everybody who's here, we're doing another 15 minutes of Q&A, and then we're gonna wrap up our Tuesday training today. So it's an abbreviated but powerful Q&A. If you're here watching live and you have a question, few questions here from the club seats. But question part two
Mhm.
of your initial one, Lori, what was that one? What was the second part of your question?
I feel like it was answered by,
Ah,
I know. Um, no, I feel like it was answered. I think it was how it applied to the method and how far down you go, but you already answered that.
oh, okay.
Yeah.
So
Or
was
I got clarity on it by like go close. Like find the ones that's closest to it.
closest to it and or the one that mostly does the same job because
Right,
synergists
right.
have like a ranking of how much of the secondary job they do. So synergist
Mm-hmm.
is the secondary action of a muscle. And so, for example, glute max is the main guy for hyperextension of the hip. We've been
Mm-hmm.
talking about him the last few weeks here in Tuesday training.
Mm-hmm.
And his helpers, plural, synergists, plural, a concert, a grouping, a posse, are the hamstrings.
Mm-hmm.
But the hamstrings also do this other thing when they're not hanging out helping glute max do his
Mm-hmm.
thing. But they are the biggest helper for glute
Mm-hmm.
max doing the thing of glute max.
Mm-hmm.
So yes, they happen to also be in close proximity to him. And that may or may not be the only indicator in every synergist.
Okay, that's what I was just gonna, yeah, ask.
Yeah.
Okay.
Okay, did that
Mm-hmm.
land?
Yeah, yeah, totally.
Okay, good. And how's my mic? Is it still working? Lori
Yep,
shared
here. Mm-hmm.
backstage that the mic was a little glitchy, which
Mm-hmm.
which I need to fix before our next summit. Everybody who's here, please mark your calendars. Our Orthopedic Practitioner Summit is happening October 13th, 14th, and 15th.
Mm-hmm.
Mark your calendar now because I know those are high clinic days for everybody, and I know you all love to be live. We will share details on sign up coming very soon, like by the end of this week. But
Mm-hmm.
it's always the same time of day, 11:30 to 2:30 Eastern, 3 days. This time it's Monday because it's a bank holiday, Monday, Tuesday, and Wednesday of that week, October 13th, 14th, and 15th. So mark your calendars.
I'll let you know.
Okay, amazing. Gary, what about you? Gary's here incognito in the club seats today. Gary, do you have a question on muscles that I can answer for you?
I'm not directly, nothing's popped up, but the explanation of the synergist being the closest is, I think, just such a key piece to
Mm,
this. So
Mhm.
when we go back and really look at the muscle charts, I
Mhm.
think that's a major help.
Mhm.
And
okay.
and then the other thing is, because I'm still struggling to learn all my muscles, that you learn the the main one that does the joint action is really key, and that takes some of the pressure off
Mhm.
to
Yeah.
memories,
Mhm.
yeah,
Yeah.
memorizing all of those.
Oh,
Yeah.
good. Yeah, I don't want you guys to feel pressured to learn the muscles. I remember that feeling though, and it's like not as fun as it could be. I want you to feel enthusiastic about them and curious, because if you're curious, you'll lean in. And when you lean
Mhm.
in, then you'll learn more. And when you learn more, you can have more, knowledge to then apply to your skill.
Mhm.
And we do need to know them. So there is a responsibility there, but not the pressure to know them.
Mhm.
I would rather you have the curiosity.
Right.
Uh, yeah.
Thank you.
Yeah, of course. And I also lay out in the course, in the muscles and movement course, I lay it out in very applicable ways. So you learn a group of muscles and what I want you to know about them that I need to know clinically, and then we workshop it out so that you actually have that skill set to build on your knowledge,
Mhm.
which really I recognize in this very moment, this just clicked for me that back in school, when we used to have final exams and this is in massage therapy school. For those of you who know, I've been around, but the second time I went through massage therapy school, I remember the teachers would look directly over the body that we were working on, and we would literally have to start our fingers at one origin and strip the muscle or outline the muscle all the way to its other attachment from origin to insertion.
Mhm.
And it had to be in that order from origin to insertion. And I remember, like, oh my gosh, this is so much pressure. This is, oh my God, what if I don't pass? Blah, blah, blah. And then later, when I went to, I passed, obviously, thank God, and everything was good. And I went back to working and I thought, how does it help me to know which one is like, how did that help me? And it did help. It did help, right? So knowing origins and insertions absolutely help because it teaches you about the leverage that the muscle can make and how much pull it can have on a particular bone so that you can see
Mhm.
it showing up in movement. And like all that's really good. So then why was it so freaking stressful? Like panic attack stressful? Here's why. Because up until then, all the learning was done sitting and listening and taking good notes and listening and taking good notes. In order to learn something and to be good at it, my
Mhm.
friends, you must learn and apply. You
Mhm.
must learn and apply. You can't just learn from a book. Otherwise, it makes the applying so much harder,
Mhm.
like super stressed, super stressed. And I'm okay taking a test, but I remember that one very clearly and thinking, why is this so hard? I almost like couldn't pay attention to the test because I was observing the test taker, me. Like, why is this so hard right now? Because we hadn't applied it up until then. You got to
Mhm.
apply it, make it easier for you because you're all active participants in the work that you're doing anyway. Whether you're a manual or a movement practitioner, you're an active participant, which means active has to
Mhm.
be it. And so many practitioners say, oh, well, I learn best by doing, I'm kinesthetic, I need to interact with the material. And yet they're the most avid note takers. So please interact with your material. Please do that. And that's one of the reasons why I lay out the courses the way I do.
Mhm.
Okay, anybody here? I don't see any questions coming in on the chat, which is good. It's just fine. It's not good or bad. It's fine. Please do ask a question though. We have like another 10 minutes left. And I'm going to share with you now a question that I answered just this week,
Mhm.
working one-on-one with a practitioner. And this was in our orthopedic accelerator program. So I was meeting one-on-one with a very talented practitioner, delighted to do that. And this question came up, right? Because this question comes like super common, right? Every one of us has a question about muscles or identifying muscles or identifying the source of the problem or how do we know what muscle's causing it or how do we know what to do? That's usually it. Like client has X, what do I do? And you guys are all really good. You don't ask me that specific question anymore, but I know that that's in there. I have a client and I want to solve the problem, and I want you to solve the problem too. I am here for you to solve the problem. Part of how I can support you doing that is by creating you into a strategic thinker so that you don't have to memorize a list of answers. You can just think differently about the problem and then come up with the answer. And that's definitely my mode of teaching. But I'm going to give you an answer that I gave in this conversation that I had with this practitioner on a particular client. And it was about how to use your muscle knowledge. Well, the question was about, I have a client and there's something going on in their hip, and what did I miss and what didn't I know? And that was all like super awesome questioning, not just what do I do about it? Like, what did I miss and how do I know what I missed? And how do I find what I missed? And so there's details and nuance to every client question. But as we sit here today with Tuesday training material and our muscles and movement focus, I want to share with you how to use a muscle or muscle knowledge to get to clarity on the source of the chief complaint. So the source of the chief complaint. The chief complaint's not the source of the problem. It's just the problem that your client's complaining about. And their symptoms are definitely not the source, because we know that symptoms are referred 90% of the time. Don't chase symptoms, guys. I mean, back in the 90s, we used to call some professionals ambulance chasers, right? When I was working in orthopedics and injuries and car accidents and things. And it was never a good connotation, the ambulance chaser. Don't be a symptom chaser, okay? So, how then can you use your high level muscle knowledge to target what is the source of the problem? What is the source of the chief complaint? And here's what I shared in training, and I'll share it with you. First off, learn all the joint actions. And you might be like, wait, I thought you were telling me how to solve a problem. I am. I'm telling you, if there was anything you were going to memorize this. Memorize all the joint actions in the body. You need to know when someone moves their arm or moves their leg, what joint action is that happening? And you've heard me say this before. It's not like the first time. We've talked about it in the principles chapter early in the spring as well. Why does it matter? Because when you know the joint action that the body is taking, trying to take, or can't take without pain, when you know the joint action, you immediately narrow down a list of 600 muscles down to 5, which gets you closer to knowing the problem. So if you want to know how to get to target the chief complaint, this is the formula. This is the path. Memorize the joint actions. If you're going to memorize anything, memorize that. There's not that many. They're easy to do, and you can move your body while you're memorizing them. Super easy. Definitely need to do that. And then right after you learn all the joint actions, so shoulder flexion, abduction, hips and shoulders both do that. Which joints don't do those actions? What actions do those joints take? And I'll tell you, when I was in conversation, the practitioner was saying, and we definitely got to the clarity of it, but this is just really common. The practitioner was saying, I was using my visual assessment and I could see that one knee, one patella is laterally rotated. But here's where the clarity comes from and why I'm driving down on this. When you're clear about what you're seeing, you can then clearly get to an answer about what you're seeing. But if you're not clear out of the gate about what you're seeing, you will continue to be clouded and or confused. So as we're talking, and again, this practitioner did amazing, and we quickly cleaned that up, and she absolutely knew the answer. But just notice when you're describing something to yourself, and it's easier when you're describing it to me because I'm listening and I can hear the word choices, and I'm like, hey, do patella, first of all, is patella a joint? No.
Yeah.
Does it rotate? No. Okay, well, then we're not even asking a clear question, which is going to make it much more challenging for us to get clarity to the answer. So, my friends, memorize the joint actions and what joints do rotate and what joints don't. Which joints, you don't have to know the joint types. I mean, we did learn that in school, and if you know them, that's great. You don't have to remember that the shoulder and the hip are ball and socket, but knowing them should indicate for you that they do a heck a lot more joint actions than a hinge joint, which is like a hinge on a door. It just no joints open and close, but doors open and close. Hinge joints on a door open and close. Joints don't open and close, but they do flex and extend. So there's just like open, close, flex, extend. Like that's the simplicity. It's just black and white. It goes in 2 directions. That's it. It's really helpful to know so that, like this savvy practitioner, when you're looking at a knee that looks like it's not straightforward like the other one, like there's a a hinge hickey-do going off, then your eyes go to there's a problem here because it doesn't look like it's supposed to. So learn your joint actions, learn which joints don't do other actions. Some do joint actions that others don't. And then the next step, so I'm giving you 3 steps here. The next step is to learn the prime mover of that joint action. You're going to name all your and learn all your joint actions. And then I want you to memorize the prime mover that does that joint's action. So if you're going to memorize flexion of the knee, the main muscle who does that. If you're going to memorize rotation, medial rotation of the shoulder, the main muscle that does that. And if you start to say, well, right, that's why we're learning them in a streamlined fashion. You're going to narrow it down so you don't pile drive yourself under data. Joint action, prime movers, memorize them. If that's all you memorized, here's what's going to get created for you. Clarity about what you're looking at, what should be happening when you're seeing a movement. Is that rotating? Is it not rotating? Is it flexing? Is it not flexing? You can see it clearly. You're also going to know one main muscle who's the heavy lifter for that joint action, which is the first one you should always target, the muscle that contracts. Gary, you brought that up too, that helped you. I love that. And then immediately after you know the joint actions and the main guys who do that joint action, you've already established by default the agonist, the other side of the lever system. Because if you know the muscle, the main muscle that does hyperextension of the hip, then you know that he has to lengthen when the hip's doing the opposite joint action. He has to lengthen when the joint's doing the opposite action. So again, you need to know the joint actions. What's opposite of what? What does hyperextension of the hip look like versus flexion of the hip? Do you know them both? Of course. And then what muscles do them? As soon as you know what muscles do them, you know the muscles that are on the opposite side of the lever. You've doubled your learning. Now you've got 3 for 1. I love twofers. I love 3 for 1s. I love it. Once you have that information about the muscle that's doing the job and the muscle who's supposed to allow it, then you can immediately start testing those muscles, assessing those muscles. Oh, Lydia's saying there's no audio. Oh, darn it. Can you hear me, Lori?
Yeah.
Yeah, you can hear me. Lydia, I'm so sorry. I don't know why you're not hearing me. Oh, that's so weird. I feel like it's almost like a Mercury retrograde, like weird things are
Well,
happening, but
it's
I have
between
it's
eclipses.
between eclipses. I have no control over the audio for YouTube, Lydia. I'm so sad about that. Maybe it was just a glitch for a second.
Yeah, I wonder if it's true for everybody or just for
I know. If
me.
anybody else who's here on YouTube, let me know. Can you hear me? I mean, I would imagine that they're all still here, but I don't know. There's
Yeah.
a huge delay in the time that someone posts something in the chat
Right.
versus when I get to see it. Okay, so let me go back to you learn the joint actions, you learn the main muscles that do that. Okay, Cheryl, you can hear me. Beautiful. Hey guys, by the way. Hi, Lydia and Cheryl. I'm glad you're here. Cheryl, I'm freaked out about my audio. Cheryl, I was having her test me on my mic too the other day. Um, learn the joint actions, learn the main muscles that do that. You will automatically have established the opposite of the lever in the antagonist, and then you can test, assess, and address the main muscle first, the agonist first. And if you need to, you can activate him. And as soon as hey, Debbie, I'm glad you can hear me too. As soon as you can activate the prime mover with a clean joint action, like it actually is flexion, it actually is rotation, you can also remedy whatever problem is there. Like that's the first step I always take. So you were asking me earlier too today, Lori, about synergists, like how far do I go and what do I do clinically? I don't do any synergist before I do an agonist, right? Like, and you already know that, but like just do the main guy first, then immediately do the opposite side of the lever. Is he being allowed to do the thing he wants to do? And you already have the antagonist because you learned it when you learned prime movers. You just flip the script. If the guy does this joint action, meaning he contracts with this joint action, he has to lengthen to do the opposite joint action. Is he doing that? And as soon as you can test, assess, and address the prime mover and then the antagonists, you've probably resolved a huge chunk of issues that you used to spin about. It's just that easy. You have to come in knowledgeable and you have to have skill on how to test and assess and address and how to do that. For sure, you have to have skill to do that. But we already talked about that. Have knowledge and then implement that knowledge. And then you're good to go. And then you start working on the synergists. And when it is a synergist, it's usually more of a complex problem. But don't default into it's too complex for me. It must be a synergist before you've tested the agonist and antagonist. Don't quit on yourself too soon. Be a finisher, be a winner. Take yourself on and know for sure. When you know, then you're confident. When you don't know, you're little tentative. Don't be tentative. Be clear. Just be clear. It's not this, then it must be something else. Even if you don't know what the something else is, at least you're clear that you know what question to go ask next, right? And then you always do. You find a community like this one and come ask questions. Like in our study hall, which is happening in an hour and a half. So you guys are going to be in study hall. For those of you who are club members or guests of the club for the week, please do join study hall. And you guys continue talking your muscles. I wish I could continue talking muscles today because this is one of my favorite topics, but I must run, must go. So today is abbreviated, but again, please save the date for the orthopedic summit coming up October 13th, 14th, and 15th. We will be back here next Tuesday for a full hour of Tuesday training. You can bring your questions then. You can also send them to me ahead of time and I will happily address them at the top of the hour. Until I see you guys next time, thank you so much for being here and contributing to a great conversation. Do great work in the world until I see you next week, same time, same channel. Bye for now.